very good morning to all of you. Thank you so much for being here and thank you so much for gracing us with your presence. It's my honor and a proud privilege today to have an opportunity to welcome the prominent personalities like you from the healthcare fraternity at the 4th edition of Time Cyber Media International Healthcare Awards and Conference 2019 in association with News One India. We are going to open this thought-sharing session to explore and emphasize the need and creed of perspective of healthcare, especially the preventive healthcare and other topics. Now I would like to invite the prominent personalities to share their thoughts with us, and I will be opening the stage for them. I'm going to start this day with our first speaker. Would like to invite Dr. Smriti Sparsh here with us to share her thoughts on female infertility with us.
Very good afternoon to everybody. I'm Dr. Smriti Sparsh from Patna. I would like to thank Time Cyber for having me here, and of course the jury for having me selected. When we talk about preventive, what is more important now is recognizing it way before a disease has actually occurred. So how it used to happen before is when somebody is actually diseased is when they come up to us in a hospital for a cure. So how can we be more entertaining and more creative that somebody would actually hear? But right now, maybe that everybody is not hearing what I'm saying. Likewise, a patient will never hear when you tell them to take preventive health. So how to be very convincing? For that, if any one of us is into infertility, is what I would request that we should work in a team. As in, if I'm working in Bihar, somebody who is into infertility or if is into any kind associated with preventive, we should work globally as a team. If anyone is also interested now, we can have a small conversation later. But if from different zones, if we work together, we have to increase our reach out to the rural sectors, and for that we actually have to work on a bigger level, as in bring up our ideas. We have to make a plan, and with that plan, how I'm working right now is I'm organizing health camps, which is freely done for the poor people. I visit the rural health camps, I mobilize the ASHA workers, and then of course I talk to the district heads and then get a camp organized. You can't organize a camp in a hospital, you have to organize it in that Sadar hospital, which is the government hospital provided to us.
We have Dr. Vijay Ramanan, who will share his thoughts on economically marginalized population with us today.
Morning, everybody. Economically challenged people have different needs. I mean, they have the same medical problems, but they don't have the money to take treatment. Prevention is a good idea for them, but I work with 3 NGOs which does work for them. First, I would mention about Red Cross that I work with. We have started a free daycare for thalassemia patients. We cater to around 140 kids per month with their transfusions and also with the chelation drug therapy. This year it's being sponsored by Mahindra & Mahindra for us. That's around 10 lakh rupees of medicine that we provide free to them.
We have to talk about how versatile it is when it comes to the processes and innovations. And for exactly that, we have Dr. Mahesh Hukmani here to present his views to this August gathering about preventive healthcare, new diagnostic tool for disease prevention, voice analysis.
Good morning all the delegates and the fraternity of medical profession, as well as the Time Cyber Media. I'm really grateful to you for providing me this valuable platform where I can share with you my research work and my knowledge. A very short introduction about me. I'm Dr. Mahesh Hukmani, and I've been practicing eye surgeries for the last 15 years. I did them actively for 10 years after passing my MS examination and went into the field of vibrational medicine and came up with a new system of diagnosing based on WHO guidelines for disease prevention. It helps in early accurate diagnosis, as well as it displays the stage-wise progression of a disease from mind into the body via blood. Now, this is a work of research into clinical practice for the last 5 years, treating more than 2,000 people, implementing on them, and we've got really good results in these 5 years. People's lives have been transformed. They don't fall sick anymore.
Time for our next speaker right here, who's going to add on the same topic. Can I please invite Dr. Anurag Sharan here on stage with us? He's going to also talk about healthcare for rural and economically marginalized people. Thank you so much for being here today.
Forgive me if I digress a little bit. I have been asked to speak about how do I, as an institution or as an individual, contribute towards the marginalized sections of the society. Just about my branch a little bit, because that will help to understand. It's right after MBBS, there's almost no exposure even to the medical professionals about my field, plastic surgery, and it's actually a super specialty. It's the mother branch. However, many things people are really not aware of, because that I can assess by the type of queries I get, even from my medical friends. So it's a mother branch, and it's probably the only surgical specialty left as of today, which has no anatomical boundaries. We truly are the only people who operate from head to toe, and we are called upon at various times of treatment in other specialties. Plastic surgery is said to be synonymous with cosmetic surgery, but that is only a fraction of what we really do. The major parts of plastic surgery, burns, especially in an economically deprived country like India, and burns continues to be a major part of the type of patients we address.
Well, we've also very overwhelmed presence of Dr. Pavan Kohli, who's here with us today, an orthopedic surgeon by profession and social activist by soul. Dr. Kohli has invested the Smidha Bhavani, and after 3 years of rigorous work.
My old friend, Dr. Saab, friends from Pune, thank you for the award. And actually, I would take this opportunity to share with you more than a Thanksgiving speech. I wanted to take this occasion to share some understandings about healthcare gleaned over the last few years. Well, I am an orthopedic surgeon who focuses on minimally invasive surgeries, joint replacements, endoscopic spine surgeries, etc. After a career spanning about 30 years in medicine, a few gold medals, a few award-winning research papers, proudly having represented my country in sports, having a few innovations to our credit, healthcare innovations. These are just memories, and what I carry with myself today is an understanding.
We will be taking a little pause from the conference right now. Like you can see, we already have two of our esteemed chief guests who have already joined us. So we will be going ahead with the award ceremony. But before I do that, I would like to introduce the esteemed chief guests who have already joined us for the day. We do have Mr. Sunil Manohar Gavaskar with us. He's one of the most favored individuals who showed the world the power of dedication and discipline. He is the textbook of technique himself. He's also the recipient of Indian Civil Honours of Padma Shri and Padma Bhushan. Thank you so much, sir, for being here, gracing the occasion. And can I please request Mrs. Pooja Thakur to come on stage and welcome Mr. Gavaskar and Dr. J.K. Singh on this auspicious day, and starting the whole day with a bouquet of flowers, with a small memento, and also lighting the lamp. A big round of applause, guys. Two very, very esteemed guests are today here, gracing the occasion for us. Can I please have Padma Shri Dr. J.K. Singh and living legend Mr. Sunil Gavaskar, along with Mr. Sharat Singh, Vice President, Times Cyber Media, Mrs. Pooja Thakur, Vice President, Times Cyber Media. Guys, a big round of applause. This is the moment that we have all of you here, and there could be no better people than these two to be awarding our very, very worthy participants here in the category. Can I please have you here? Best Dental Implant Service Provider in Chennai, and the award goes to Senthil Dental Care. And I please welcome Dr. Manikant Prabhu. Most promising Ayurveda PAL specialist in Mumbai, and the award goes to Dr. Syed Mir. Can we please have Dr. Syed Mir on stage to receive this recognition of trophy and certificate? In the category of Among Best IVF Clinic in Patna, Bihar, the award goes to Matrikare Maternity and IVF Clinic. And please welcome Dr. Smriti Sparsh, Infertility Consultant. Our next category of Most Promising Hair Transplant and Skin Clinic in Thane, and the award goes to Dermatrix Encoding the Body Matrix. And can we please welcome Dr. Rajendra Patil, Managing Director of Dermatrix, on stage to receive the honor. In our next category of Among Best Homeopathy Consultant in Lucknow, the award goes to Dr. Jay Kumar Verma. Please welcome Dr. Jay Kumar on stage. Moving on to the next category of Best Single Specialty Hospital Urology in Andhra Pradesh, and the award goes to Prashant Hospital. Please welcome Mr. Dhruv Srinivas Chakravarti on stage to receive the award. Our next category of Among Best Cancer Specialists in Patna, the award goes to Dr. Abhishek Anand. Can we please welcome Dr. Abhishek Anand on stage? Like we said, the best IVF center in Kalyan, Maharashtra goes to Uma Fertility. Please welcome Dr. Sainath Bairagi, Director of Uma Fertility, on the stage to receive the trophy. The next award for Among Best Healthcare Services Provider Company in Vellore, Tamil Nadu, the award goes to Sri Narayani Hospital and Research Center, and we do have Dr. N. Balaji